Hello everyone, this is Golnaz ATEFI. I'm a fourth year PhD student based in Maastricht University. Today I'm going to present a protocol of a mixed methods feasibility study that is currently going on in Maastricht. It's about a blended intervention based on acceptance and commitment therapy for informal caregivers of people with dementia. Maybe we can start by what acceptance and commitment therapy, shortly ACT, is. Well, ACT is part of the third wave behavioral therapy. According to ACT, challenging and difficult situations in life are inevitable and out of control. However, by showing acceptance, we can provide useful investment toward our time and resources and energy in facing those difficult and challenging situations. Acceptance has shown promises in the context of caregiving because it can support informal caregivers with their everyday life tasks, responsibilities, or perhaps difficulties. So our study is focusing on increasing acceptance in informal caregivers. The aim of our study is evaluating feasibility and acceptability of such intervention. We are also interested in preliminary effectiveness and clinical outcomes in short and long term. We are including quite broad inclusion criteria. We are involving informal caregivers of patients with any type or stage of dementia. Caregivers need to be self-identified and provide at least 1 hour per day of caregiving for the person. Since our intervention is internet-based and web-based, it's required to have access to the internet. And of course, they shouldn't have received any psychological treatment over the last 3 months. We are involving 3 ranges of outcomes: feasibility outcomes, process measures, and clinical or psychological outcomes. We're tracking recruitment rates, dropouts, attrition rate, and we're also reaching out by semi-structured interviews and ask about user experience and how informal caregivers experience the intervention. Our blended interventions has basically 3 main components. One is goal setting, one is coaching, and one is the web-based self-help material. So by goal setting, I mean, at the beginning of the study, we are reaching out to the participants, and during a semi-structured interview, we discuss most wanted values of the informal caregivers, most wanted areas in life that informal caregivers would like to spend more time toward them. Then we will provide some SMART goals together. By SMART, it's actually a framework. The goals needs to be specific, measurable, achievable, realistic, and time-based. Once we defined 1 or 2 goals for participants, we will provide a login for our web-based platform. This is an existing platform with ACT material however, is narrowed down for the need of informal caregivers. We are releasing modules weekly over 9 weeks so that informal caregivers can attain to their goals, at the same time use acceptance and commitment therapy, tips and tricks to attain to those value-based goals. Along the way, they might need some sort of motivations, because of course this is a technology-based type of interventions, and it's about changing behavior, changing attitude, and probably in older age, it might be a bit challenging. That is why we are providing weekly coaching. The main aim of these sessions are providing motivation and addressing any technical problems with technology only. So the coach is just tracking the motivation and technical problems. Our intervention has 9 weeks, but we also consider some sort of flexibility in time. So informal caregivers can complete the intervention between 9 to 12 weeks. After the intervention, we will have a semi-structured interview and also post-intervention assessments to see how informal caregivers experience it. And then we turn the weekly coaching to monthly booster sessions, because changing behaviors, according to previous studies, takes time. And providing booster sessions over time might facilitate informal caregivers to stick to whatever they learn during the intervention in long term. And then we will provide assessments in 3 months and 6 months follow-up. We have recruited 24 participants out of 30. And it has been going well so far. It has shown feasibility and acceptability. Hopefully, the result of this study will provide insight on how mechanism of change help the positive change in psychological and clinical outcome in older adults and informal caregivers of people with dementia. I am looking forward to provide the full result next time. Thank you very much for your attention. Of course, if you wanted to reach out, please do by this email address. Thank you.